Okay. Thanks everybody for joining us. Today we're going to talk about misinformation in healthcare. My name is Gail Matheson. I'm a librarian with Minnet, and also with us today is Orvi Dingwall, who's the head of outreach services. So we'll start off with our land acknowledgement as part of the University of Manitoba. The University of Manitoba campuses are located on original lands of Anishinaabe, Inninewak, Ansininewak, Dakota Oyate and Dene, and the national homeland of the Red River Métis. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration.
And Gail, maybe I'll just note that Saturday is Indigenous Peoples Day here in Canada. And there's lots of great events going on in celebration, and including at the University of Manitoba, we celebrate a day early during our workday. So we'll definitely be participating in some of those events on Friday.
Yes. So today we're using Zoom webinar. You have a few options available to you. You can turn your closed captioning on or off. If you have any questions, you can enter them in the chat box at any time, and we'll hopefully be able to answer them. And you could also use the React features and share a thumbs up or a thumbs down if you want as we go through. And we're using Menti, like Orvi had said earlier. So all you have to do is go to menti.com. I've also popped it into the chat in case you get disconnected or somebody joins later. And you just have to enter this code and it will connect you right to all of our polls as we pop them up. So the objectives for today's session are you'll be able to identify Minet's primary library services. You'll be able to define what misinformation is, be able to identify misinformation, be able to respond to misinformation, and also be able to find credible information. We will be circulating the slides after the session. We'll email them out so you don't have to copy things down, and we'll have all the links set up and everything so you can just click through to things. So what is Minet? Minet is Manitoba's Health Information Knowledge Network. We're from the University of Manitoba Health Science Libraries, and we provide library service to the staff of Manitoba Health, fee-for-service physicians in Manitoba, and staff of participating regional health authorities. Just a list of the regional health authorities. The one exclusion is the Brandon area. But if you're not sure if you would qualify for Minnet Library Service, just send us an email and we'll help you figure that out, because if you are providing service to other areas of the region, you may be eligible. So our team, Orvi, who's the head of outreach services, myself, who's the Minnet librarian, and we also have Cheryl, Pam, and Kathy on our team, and they are our library technicians, and they are the people that will respond to emails that you send to our regular Minnet email address, or if you're giving us a call, they will answer our phone line. So Minnet library accounts are free. All you have to do is complete a borrower registration form that you can find on our website. And then you just have to email or fax it back to us, and we will get you set up with your account information. So the library services that you have access to with your library account, literature searches. So if you have a topic that you're interested in, we will go through and do all of the searching for you, look in different databases, and we will provide you a list of citations. We also have document delivery. So if you are Google searching and you come up against a paywall, or you find you're looking in a reference list and you want access to something, just send us the citation and we will send you the full text of that item. You don't have to pay for anything. You also have access to UpToDate with your library account. So it's a clinical care support tool that you can use your account to log in and be able to search on your own. We also have other training, education, and orientation sessions. So like today's session, we have a number of videos on our website that are there that you can watch anytime. But if you want a one-on-one session, or you'd like us to come to a meeting or have a group that you think would benefit from some of our instruction sessions, we're happy to come and do that. We can also customize sessions for you. And we also have a current awareness service. So if you have a topic you want to stay up to date on, maybe a favorite journal or a favorite author, we can set up an alert so that you receive weekly emails with new things that have been published. So our first poll question, so hopefully everybody was able to get onto Menti and get that all set up. But let us know what MyNet services you've used.
And so to answer the poll, you can, in your browser or in the browser on your phone, go to menti.com and then use the vote code 9693. And we see some of you have already figured it out. That's awesome.
I just realized we don't have one that says I've never used services before.
Oh, boarding.
Sorry to anybody that hasn't used the services before.
That's okay. They can just not respond. Okay,
And that's great.
excellent. All right, I'll take us back to the slides here. There we go.
Okay, so now to get into health misinformation. So we know that this topic can be really daunting and it can be scary right now with things that we're seeing happening in the United States, the prevalence of social media use to get health information. It can just feel like it's getting worse and we have no control over how much health misinformation is out there. But the purpose of today's session is really to provide resources and tools that you can use to help you respond and develop those strategies towards combating misinformation. Misinformation isn't going away, but there are things that you can do to help. And I do think that we have a bigger impact than we think that we do. So next we have another poll question. And what does misinformation mean to you? And there's no wrong answer here, just curious what people are thinking about misinformation.
And we know it takes everybody just a minute to think of their answer and then type it in. And for those just joining us now, you can answer or put your thoughts into the poll by going to menti.com and using the vote code at the top of the screen, 96933583.
Not validated by peer review, absolutely. Without facts, yeah. That's great.
More work, yeah, exactly. Okay, we'll leave this live, and you can still put in your answers as you think about it. And saying like, I'm not sure is also totally valid, just so we can get a sense of where you are.
Yeah. So misinformation is very basically false, inaccurate information, getting the facts wrong. So there are two kind of categories when we're talking about misinformation that you can look at, I guess. Denialism and snake oil. So denialism, including things like conspiracy theory, where you might have a group that's trying to convince others that a government or organizations are just wrong or are lying. Cherry picking, where you're choosing the data that supports your particular belief to use. Double standards, if your belief is disproven, then you just slightly change to something different. And tame experts, so using maybe a few scientists that are trying to challenge more broadly accepted belief, or maybe using someone that just has a PhD, whether it's related to the subject you're talking about or not. And then snake oil, thinking about cure-alls or personal testimonies, something working for them, quick fixes. And both categories have a huge distrust of the scientific and medical authorities. So our next poll question is, what is disinformation?
And again, if you're not sure, you can enter that.
Yeah. Opinions? Intentionally misleading, yeah.
Okay. Either everyone's shy, or they're a bit stumped, or a little of both.
And that's okay. I'm always shy. So disinformation is purposefully sharing false information. You're deliberately intending to mislead people, intentionally misstating the facts. So AI is actually being used as a tool to create disinformation and create things that are purposefully misleading. Um, We have had a few previous sessions on AI that we've done, and we have links to those videos on our website if you're interested in a little bit more information into AI. But most of us think about AI or generative AI as a tool that we can use to create content. So another aspect to that AI is um, thinking about what kind of content that we are producing ourselves as well, and making sure that we're understanding that the output of different AI models is based on the data that they've been trained on. So you're not going to necessarily get the same answer from ChatGPT and Copilot, and that there is the potential for AI to provide hallucinations and just incorrect information. And if the data that AI models are trained on is biased, then the responses that they produce can provide biased information. So again, just being aware that the need for fact checking anything that we're creating with AI, so we aren't producing misinformation ourselves. And another bright spot maybe is that IBM is using Watson right now to try to create a misinformation tracker or detector. So there might be something in the future that may be helpful to help combat misinformation, but something to hopefully look forward to. So the impacts of misinformation on health are huge. Um, if people are uh, using treatments that can be unsafe, they could cause illness and death, different interventions, um, the money that they waste on those products or services. Then thinking about vaccine hesitancy and communicable diseases, not only for individuals, but also for communities, and the spread of communicable disease and the impacts on the broader healthcare systems. And financially, those costs related to having to treat preventable diseases. And also the concept of, if we are consuming misinformation, then it makes us more susceptible to further misinformation in the future. And it can also have an impact on public policy. And this list isn't exhaustive. There are lots of other impacts. These are just kind of the top ones in the list. So our next poll question, what health misinformation and or disinformation trends are concerning you right now?
Oh, except I might have forgot to put that one in,
Oh, well, that's okay.
or I changed it. So instead we're asking, sorry about that, everybody. How often do you encounter misinformation or disinformation at work? Sorry, Gail.
No, that's okay. Keeping me on my toes. It's a good range.
Okay. Oh, great.
Okay. So thinking about Canadian susceptibility to misinformation. So the Canadian Medical Association has an annual health and media tracking survey that they do. And if you haven't seen it before, it is a really great document. It's quite a quick look through. There's lots of charts and diagrams, so it's easy. It's easy to read. It's a quick read. Um, just go to the next slide. And they have some, just their key takeaways from the survey are that Canadians are encountering misinformation more often. There's a trend of news avoidance. Social media is contributing to the susceptibility of health misinformation. And they found a direct link to misinformation and negative health outcomes, and need more collaborative efforts to combat misinformation. So just some of the top takeaways from the survey itself. But then thinking about the key trends in media, they found that more Canadians are turning to social media for the news and fewer are going to news organizations. We've also seen Bill C-18 in 2023, where news organizations aren't able to share on social media accounts. So again, creating a space where for misinformation to come in and fill that gap. And then looking at media habits by generation, they've looked at Facebook, YouTube, Instagram, Twitter in comparison to watching news on TV. And you can see a huge uptake of social media there. I think this is a bit of a bright spot in some of the research and showing that there actually is a huge amount of trust in physicians and pharmacists, nurses, healthcare professionals that have developed personal relationships with people. So there is a lot of trust within the healthcare system. But just on the next slide, some of the challenges with that being that a lot of Manitobans don't have family physicians, and not just a Manitoba problem, but across Canada. So it's creating, again, a space where social media is coming in and filling with more health information. And then they asked the question, who do you feel is most responsible to safeguard Canadians against health misinformation? And I do think this is a positive as well, because they see Health Canada, provincial ministries of health, and associations as trusted places to be receiving health information from. So I do think that this shows that health organizations are positioned really well to start providing some of that information to combat the misinformation that's out there. And I do include libraries and librarians in this as well. And it creates a space for us to be able to support your work if you're creating campaigns to help combat that misinformation. Yeah, and then just thinking about your responses to that poll question that we had, they had asked Canadians, how often, if at all, have you ever encountered health information or news that you later found out was false or misleading? And I find it really interesting that only 18% often or all the time thought that they were being exposed to health misinformation. And if you were to go back to that slide that showed the breakdown of social media, even boomers are using Facebook 60% daily. And with the amount of health misinformation that we know exists on social media, what this says to me is I think people really don't know how to identify misinformation. And I think it creates a space where we can use that to help teach people how to identify that misinformation going forward. So our next poll question, what are tools or strategies you use to identify misinformation or disinformation? And if you don't have any, you can put that in. Different sources, yeah. Comparing things. Too good to be true. Absolutely. Yeah, look at reputable websites to compare. Yeah, and see what they're saying. CME sources.
Great. Yeah, those are all great. And we've got some more that I'm gonna take you through some of our favorites. So if you've been here before, you know that my favorite is the CRAP test. And another favorite of ours is developed by an international Federation of Library Associations. And these are just meant to be really quick when you're looking at things or you're thinking about stuff, just to do a quick little check before you might need to do a deeper dive with a critical appraisal assessment. So CRAP is an acronym and the C is for currency. And it's just about checking the date. Is there even a date on this thing that you're looking at? And depending on what you're looking for might depend on how recent or current you need it to be. So if it was in March of or April of 2020 and you were needing COVID information, information that was a day old that was out of date by that point. You needed things within the last 2 hours. Whereas if you're doing a historical look at something, something from 500 years ago or 50 years ago, that might be the right date for you. So being current is specific to the context that you're looking at. And then when we're thinking about misinformation, a classic example, I think, is the Andrew Wakefield article from The Lancet, where he claimed that he had found this association between measles vaccines and autism. And of course, that has been retracted from The Lancet, but you can still pull up old versions of that article. And so but the currency of that would be outdated. So looking for whether something's been retracted, whether that's the current version, these are all really important steps to combating misinformation and also identifying it. Then the R is about reliability. And a good thing to look at is, are there any sources that are being cited in what you're looking at? Is it peer reviewed? That was what some of you are looking for. And if you're not sure, just like, is this something I can trust or not? Like, what is this thing? That's something Gail and I can absolutely help with to take a look and say, like, yes, this is a reputable journal. And sometimes some of you have sent us stuff and it's taken us a while to figure out what exactly it is. Sometimes it's a little tricky to say like, yes or no, this is a spoof thing, or this is was developed to spread misinformation, or like this is a legit journal that's just getting started and English is not the first language of the authors. That sometimes happens. So we can help with it, but looking at reliability is one important part of your checklist. There's also these different tools to help identify whether something is reliable or not. And again, we'll circulate the slides so you can click onto these and check them out. So depending on what you're looking at, you might want to use I can't say this, the ones about politics, fact checking political information, if you're looking at a photo to see if it's real or not. And then there's medical and science checkers as well. So these are really great and helpful if if whatever you're looking at is included within them. So definitely some sources to, or some tools to put in your toolbox. And then when thinking about misinformation and thinking about reliability, non-peer review is definitely top of the charts. And also being cautious about predatory publishers. So information is big business, and places sometimes create pages that look like reputable journals, but really are not. And again, we can help assess whether they're reliable sources or not. The A is on authority, and this is when you're considering the source and what its mission is. And a good giveaway is often if they're trying to sell you something, and particularly if it is related to what they're warning you against. So thinking about people who are using scare tactics about toxins that are in your bodies, and then they'll sell you herbal remedies to combat those kinds of things, definitely alarm bells should be ringing. And checking the author sometimes is easier said than done, because some of these spoof sites, they take pictures of real people, real experts, and they put them on their editorial board, or they claim that they're related to the work that's being done. So again, something that we can help with. And sometimes it's a lot easier if you're just like looking into it and you see that they are not a real person, or that they have false credentials, or they don't have credentials that match with the claims and the expertise they're claiming to have. And thinking a little bit more about authority, there's also imposter social media accounts, and there are the mimicking of legitimate websites or legitimate URLs, and just inventing credentials or inventing credentials from invented universities. And there's also people who use the credentials they do have, but then expand their expertise into areas that they are not actually experts. And also using creative ways around to try to support the claims that they're making, such as using the court system or doing their own interpretation of published studies. Those sorts of things, when they're saying like, I know better than all the rest of the scientific community, these are when we should have our alarm bells ringing. So I know that lots of you will have different reasons for being here today, and you wear different hats. So maybe you're thinking about misinformation in a clinical setting when you're encountering patients. Maybe you're thinking about policy implications or rollout of public health initiatives, or maybe you're just thinking about how to survive conversations at summer gatherings with family members this summer, or whatever it is. But hopefully we're providing you with tools that you can use in any number of these situations. And so one way is to be able to identify and spot fake social media accounts. And this is a checklist developed by the Government of Canada to kind of help you go through and assess the validity and the realness of those social media accounts. And then for spotting these fake websites or these websites that have been created to spread misinformation, you can just, if somebody's claiming or citing a source or citing a website, you can just go to that website and check it out and see if it even exists and what the authority is like on it. And there's also a web tool called Who Is, where you can look up the website to see who owns it. And sometimes you'll be able to easily follow the money and find it's somebody trying to sell you something or promote their own version of truth. And so that's a great resource that you can use. And then finally, the P in the crap test is for the purpose or the point of view. So again, are they trying to sell you something? Are they biased in what they're presenting? And this is a general tip that we're always saying, you know, if you're thinking about a clinical intervention and you're like, I think that this is the way to do it, or that this is the best practice currently, then, and you look it up and you find some websites that are confirming what you thought, make sure you're also looking for an alternate view to see if actually you've missed something or you've just confirmed your bias, and also just to know generally what's out there. And also be wary of sometimes it's just a joke. So sometimes we all get a little caught on an article by the Beaverton or the Onion or just spoofing websites that's just meant to be satirical. And definitely make sure you're reading beyond the headline. Even in peer-reviewed, high-quality journals, read beyond the abstract, because the proof is really in all of those details. And sometimes there's definitely a bunch of scholarly literature that demonstrates a bunch of abstracts actually don't match what's actually in the full version of the text. So making sure we're getting it right definitely takes time and attention to those details. So on the purpose and the point of view, when it comes to misinformation, there's really creative, well-resourced people out there that do all kinds of things. So they'll create their own think tanks, they'll create their own institutes that have values-based names to them. And often then you can get yourself mixed up to be like, I know that there's these two things, and one is misinformation and one is actual information, but their names are so similar, and that's all by design to get everyone mixed up. And there's also then alternate agendas definitely being put forward. So be careful of all of these things. And then of course, then you need to respond. What do you do if you've identified misinformation, or when you know that disinformation and misinformation are out there? I'm going to ask you I think I made a poll about this. Oh, no, I'm so sorry. That was just my spoiler to take us to the next slide. So how do you respond? Gail has been researching this for the last month, and there's so many really great resources out there that provide you with frameworks on how to move forward in what you're doing. And again, whether it's just having a difficult conversation with a family member, whether it is rolling out a campaign within your region or your workplace, or whatever it might be, there are a whole bunch of tools that are available. So I think thing number one with misinformation is just don't repeat it, and just spread actual information widely, and don't mention the misinformation. And engage with experts. Like Gail said, there's a high and strong rating of physicians, pharmacists, nurses, and people trust them, at least right now here in Canada. And so just debunk all of that misinformation and disinformation with actual evidence-based information. And there are also getting involved, either creating your own or getting involved in the different groups that are working to battle fake news and to increase health literacy. There's lots of great ways out there. And then partnering with community groups and other organizations is really important. You know, a really great success story from here in Canada is the partnership on the Mpox vaccines. and where public health worked really closely with 2S LGBTQIA+ communities and different community organizations. And to date, there have been no deaths in Canada from Mpox, which is a really great success story. And you can track it back to those early partnerships with how that got rolled out. So like Gail started off by saying, we see really awful things all day, every day in the news and in the media and out and about in our daily lives. But there are real glimmers of hope and real stories of success where we've got it right with healthcare here in Canada and in Manitoba. So how to respond? Johns Hopkins University created a practical playbook for addressing health rumors. And this is a 10-step guide, and the whole report is freely available. And it just takes you through on how to debunk it, whether you're even going to address the rumor, and what will influence your decisions to respond, how to take action, how to choose the right approach. All of these things take you through this step-by-step guide. And then similarly for pre-bunking, a partnership out of the University of Cambridge with Google's parent company, Jigsaw, talks about pre-bunking. And so this is really getting ahead of something that we know could go really wrong and really viral. And pre-bunking is actually not so much about, okay, we know, measles is on the rise and we know people are still vaccine reluctant. How are we going to talk specifically about vaccines? It's actually about how are people being getting this misinformation and why are they believing it? And how can we sort of stop that from even happening in the first place so that the authoritative sources and trusted sources are actually able to get that information out. So some really excellent information in this collaboration. And again, the focus here is on dismantling the foundations of how misinformation spreads and using techniques to stop that from happening. And a pre-bunking checklist from this group as well, again, just takes you through it. So choose your subject, maybe it's vaccines. I'm a little obsessed with measles vaccines. I don't know, I just keep hearing about it. And it hurts my heart to know that people aren't vaccinated. Choose your audience, define your goals, choose your approach, like really straightforward, well, seemingly straightforward checklist, of course, with each of those steps, a really detailed and robust workflow for each of those. And then having those challenging conversations. So I'm certain we've all had them. We've all seen our family members make posts on social media that were spreading misinformation. You can just easily, at least still on some of them, you can report them as misinformation, but you can also just talk to those family members. And these are some guides about how to have those conversations and some specific about vaccines. So there's definitely resources out there to help. And if you're thinking, okay, I've got a really specific situation and I'd like to know whether there's these types of resources for having these difficult conversations with whoever it is that you want to have them with, we can also dive deeper and do those searches for you. Those are the kinds of literature searches that we do. And of course, like many of you said in the Menti poll, you can find reliable sources and share those. And so certainly PubMed is the largest free resource of evidence-based information in the world. UpToDate's really great. The TRIP database is really great. And through Google Scholar as well. And if you want a refresh on how to search these things or on authoritative information, on the MyNet website, there's recordings of our Searching for Health Information session that goes through in more detail how to search these and do a bit of critical appraisal on them. And reminder, if you're not comfortable doing those searches yourself, or if you just don't have the time or you just don't want to, that's definitely what Gail and I are here to help you with. We're happy to do those searches for you. Okay, so that's a lot that we go over really quickly. And and some of it's really a downer when we think about measles outbreaks, vaccine reluctance, all the unfounded misinformation that's spread through, like under the guise of wellness. But there are some good stories out there, and there are some positive things to take away. So we definitely want to hear what positive takeaways we've shared with you today about misinformation and how you can contribute to using and promoting high quality and health information.
Yeah, that pre-bunking guide is really great. It's really comprehensive. It takes you step by step. And the same with the debunking as well. They both, there's a lot to dig into once you get into the resource. So highly recommend them both.
I'm putting one in as you all think.
The crap test, yeah. It's been around a long time, and it seems so simple, but at the same time, it's a great acronym. And I've taught it to middle school kids, and they really love it too. So it's something that is really adaptable, no matter what the age or the level of information that you're looking at is.
Yeah, and maybe while you're sharing some more, some other positive takeaways or some positive actions that can be taken. I think the report that came out recently about how positive the cell phone ban in schools here in Manitoba and in other provinces. That's really positive, both for the health of young children, but also to help keep, have dedicated hours when they're not on social media or not on social media at all is definitely really helpful and encouraging. Yeah, uphill battle for sure. Who wrote that? Yeah, Liz. Okay. Great. Okay. So that brings us to the end of our prepared presentation, but we're happy to answer any questions that you might have. So you can pop those in the chat. You can follow up with us later if you have them. At the end of all of our education sessions, usually about the next day, then we'll send out the slides, and we also send out just a really quick evaluation that helps inform our future sessions. But we really appreciate you being here today. It's definitely an uphill battle with misinformation and disinformation. And we really just wanted, one, to make sure your attention was drawn to it and you were thinking about it, and also to make sure that you knew that there's all these resources out there to help combat it. And if you're looking for a really, really simple solution, supporting local journalism is also a really great way to do that. So make sure you've got your subscription to the Free Press or whatever your favorite local journalist is, because it's through independent media and their analysis that we also have a common source